Alrighty, you're live.
Good morning, everyone. It's Danielle with Dr. Emer's office. We are starting off our morning with a really good combo therapy. So we started with a salt facial, which is great for exfoliation. It uses natural sea salt. So it really clarifies the skin, it exfoliates any dead skin cells, but most importantly, it preps our skin really well for laser. So the next thing we're doing is actually radiofrequency. It's Fractora. So this is the 24-pin tip. It is coated. So this is very safe for all skin types. Our patient does have a little bit of pigmentation changes in her skin, but mostly we're looking to tighten and soften some of those acne scars. So after we do this treatment, we're gonna go ahead and top it off with Cosmelan, which is a chemical peel for brightening. Because it has such a high concentration of retinol and hydroquinone, it's awesome for acne scarring, just brightening any pigmentation, but also really exfoliating away so your fine lines, everything looks better. So we're gonna get started, do one little test pulse, but I want you to just look at her skin. We did a salt facial already, and she's not scratchy looking, she's not red, there's no irritation. Her skin looks really great. She actually just said that she feels like she got a little liquid lift. When you do these kind of treatments and you're getting regular facials, you're stimulating all kinds of lymphatic flow, circulation, so your skin really does plump up, look a little bit better, and of course you're brushing off all those dead skin cells on the surface. So we're gonna get started right up top here, first one. So the benefit of Fractora and why we want to incorporate it now is that it's going to remodel the skin, it's going to smoothen, it's going to tighten up the skin, and when we stimulate collagen, we revitalize what has been lost in the damaged areas of the acne scars. So when collagen is lost, you end up with lines, crepiness, stretch marks, for example, where the skin spreads apart quickly and it doesn't have enough time to rebuild those skin cells. Treatments such as this with the needling mechanism and the radiofrequency are really good for tightening that skin back up. You doing okay? Okay. So I told our patient we would get the forehead done first because it is more uncomfortable, but this is going to be a phenomenal treatment for her. She will see some nice lifting, and her overall skin texture is going to improve pretty quickly. So I love how fast the results set in like this.
How often can you do this treatment?
So typically I'm recommending this treatment every month. That's a pretty good time frame. It gives your skin enough time to heal thoroughly and kind of just prepare for the next round. I'm feeling that by the 3-week point, your skin is looking its best after this treatment. So that's definitely, do you need a little break? You okay?
Yeah, fine.
That's definitely the time frame I like to stick to. You know, sometimes for patients who heal very quickly or if it's a little bit lighter treatment, we can repeat it more frequently, but 4 weeks is pretty standard. You can see there's really not bleeding. I don't know if you can see it closely, there's just this little like needle texture in the skin where these pins have gone in through the top of the skin. Those will turn into these little baby scabs that just feel sandy. But as of right now, you know, not terribly red, very, very mild pinpoint bleeding. I'm gonna go ahead and turn you back this way. The redness will develop. So what's normal is, of course, the redness, some mild swelling. And now as far as downtime goes, the redness and the swelling tend to last about a day, and they can be soothed with cool compresses, a nice cold sheet mask, which we'll apply at the end. I'm just gonna position you a little bit better. There we go. The next day, the redness has really subsided, and all you're seeing are these little tiny poke marks. So after a few days, they turn into those baby scabs. They flake away around a week. And it's very minimal. People rarely notice it. I usually have it done and go to work the next day. So as far as downtime goes, you can really generalize it to be 2 or 3 days. You need a breather?
Yeah, it's okay.
You're okay? Cool. So 2 or 3 days of downtime. This is a really good weekend treatment. So you could do it on a Friday and be pretty good at work by Monday. Any other questions?
During your downtime, can you put makeup on?
Absolutely. I definitely would try to avoid it for the first day. But I'm a big fan of being able to squeeze in your maintenance and your treatments with your normal schedule. So I don't mind if you're using makeup the following day. Ideally, it would be a mineral-based makeup, definitely with some sun protection. And my recommendation for that would be only use it when you need it. If you don't really need it, avoid it. Try just like a tinted sunscreen. But if you are using makeup, that's fine. Just wash your face very well afterwards. Make sure that you've removed all of it so that your skin continues to heal with a nice clean surface. So we are moving along. We're doing a really nice high energy setting. The radiofrequency is going to be super good for her skin. What it does is it actually works on shrinking the oil glands. So it's good for someone who has active acne as well as scarring. So you have a lot of benefit there. So as far as comfort level for this, it is a little bit uncomfortable. We do numb topically for it. And typically it's a quick treatment. The nice thing about doing this treatment prior to our chemical peel is that our chemical peel is not going to burn. It's not going to sting, she's not going to tingle, and we're not going to neutralize it in just a couple minutes on the skin. The one that we use often is like a mud mask. We'll leave it on the skin for a few hours. Now you can sort of see this redness that has developed here. So that's our clinical endpoint, right to the middle. The nice thing about doing this treatment prior to the peel is that we're creating all these little channels in the skin right now with the needling device. So once we do put that peel on, it's going to penetrate a little bit deeper, be a little bit stronger, and work a little bit better. So combining it, even if it was just the peel combined with a salt facial, by prepping the skin, you're really maximizing all the effort that you're putting in. So we love to do that. Alright guys, so I'm going to finish up here. She's doing amazingly. You can see some of this redness that's kicking in. Very, very minimal swelling, if anything. You can kind of see it right along here. Very minimal swelling, just that circular texture. A little bit of neat swelling around each of these little access points. So that's our clinical endpoint. That's a little bit of the Fractora treatment. So I'm going to finish up, and then we'll touch base in a few minutes when we apply her cosmeline. Thanks for watching, everyone. You're almost done. Doing okay? Mm-hmm. Is it the worst treatment you've ever had?
No.
Okay.